Now, meantime, the United States National Academy of Medicine has appointed Africa Health Research Institute Professor Thumbi Ndung'u as a member. The Academy recognizes individuals who have demonstrated outstanding professional achievements and commitment to service. On the back of the announcement, or rather, in fact, Professor Ndung'u joins us now. Professor, congratulations on your election to the National Academy of Medicinal Work. What does this mean for you?
Thank you very much, Hugo, and thank you for having me on the show. It's a great honor to be elected a member of the National Academy of Medicine. As you mentioned there, it recognizes individuals that have done outstanding work in the fields of medicine and health. And so the Academy has only about 2,400 members. And so to be recognized as one of those individuals that have contributed significantly to medicine and health is a great honor, and I'm really delighted, not just for myself, but also for the many people that I've worked with at the Africa Health Research Institute, at the University of KwaZulu-Natal, that have also enabled this recognition.
Now, you work on HIV-1 subtype C, or rather your work has been groundbreaking. How do you envision this research and advancing global efforts to combat HIV?
It's actually an honor that I'm being recognized at this particular time when we are moving towards commemorating World AIDS Day. I think we need to acknowledge that we have made a lot of progress in the fight against HIV. There have been a lot of scientific advances that now help us to treat this infection, but also prevent it. But we are not out of the woods completely yet, because there are still many more people that are getting the virus than what UNAIDS had targeted. And so we need to redouble our efforts. And I think that one way to do that would be to develop new innovative ways to prevent HIV infection. That means the development of a vaccine. But also we are now beginning to think of a cure for HIV. And although it seems difficult at this stage, I don't think it's impossible. I think that when we first developed antiretroviral medication, people thought that it was impossible, and now see where we are. And therefore, I think that we should continue to work towards a vaccine and a cure for HIV.
Now, collaboration is key in health research. How have African partnerships shaped your work, and to what level of impact? Because I'd imagine that Africa is a critical source area, if you will, for want of a better description, primarily because some of the highest incidents of HIV infection are on the continent.
You're absolutely right, Hugo. And actually, when I started in this field about 30 years ago, most of the collaborations were between the North and the South, high-income countries and those of us that are working in resource-limited settings, such as Africa. But I think that the tide has begun to change and to shift significantly. So whereas those partnerships with our northern partners continue to remain important, I think there is much more recognition that we need to be collaborating and working together in Africa. And I'm very proud to be associated with a consortium known as the Sub-Saharan African Network for TB and HIV Research Excellence, which is an African-led consortia that seeks to develop African solutions, as it were, by bringing together researchers and communities in Sub-Saharan Africa to address particularly the problems of HIV and TB. So I think that partnerships are really important. And even in my own career, it is these partnerships with colleagues in the global North, but more particularly here in the global South, collaborations between governments and communities, collaborations between academics and students, their students and trainees, that have enabled progress. And
well, so it's certainly excellent work that you've been doing, Professor, in collaboration, obviously, with your colleagues. I appreciate your time, Professor Ndung'u, who's been appointed as the United States National Academy of